Hey everyone, welcome back to our channel. My name is Brianna Wilson. I'm a certified dementia practitioner and the founder of Bambu Care. So for today's video, I wanted to answer the commonly asked question, at what age does dementia start? And this is a really great question. So when we're broadly speaking about dementia, it's important to understand that dementia can literally start at any age. There's even what we call childhood dementias, which typically have a genetic cause. And so the onset of the genetic diseases that cause childhood dementia can start anywhere from birth all the way to young adulthood. And if you want to learn more about childhood dementias, I strongly encourage you to check out childhooddementia.org. Now, I know that when most people are asking this question, those are not the type of dementias that they're talking about because a lot of people don't know about them. What they're referring to are the ones that we hear about all the time, like neurodegenerative progressive forms of dementia, like Alzheimer's disease, Lewy Body dementia, vascular dementia, frontotemporal dementia. And so when we think about the age of onset, usually it's broken into two categories. We have early onset and we have late onset. So early onset is when the symptoms appear any age before the age of 65, and then late onset is when the symptoms appear at 65 years or older, okay? So let's break this down a bit. So when we think of Alzheimer's disease, the majority of people will develop symptoms after the age of 65, as the risk does increase with age. But there are some people who develop early onset Alzheimer's disease, and in that case, their symptoms appear between the ages of like 30 and 60. Now, if the cause of Alzheimer's disease is genetic in nature, then we typically see them fit into that early onset category, but that's not always the case as there is late onset familial Alzheimer's disease as well. And not everyone with early onset dementia has a genetic cause for their Alzheimer's disease. In fact, most causes of Alzheimer's disease are not genetic. Genetic causes of Alzheimer's disease only make up about 5% of cases, okay? Now, when we think of frontotemporal dementia, the age of onset typically falls into that early onset category. So most people with frontotemporal dementia will develop symptoms between the ages of 40 and 65. That makes up about 60% of cases. So that means that the other 40% would fall into that later onset category where their symptoms start at the age of 65 or older, okay? For vascular dementia, the risk does increase with age. So we typically see people develop vascular dementia after the age of 65. And so people who have a history of like heart attacks, strokes, even mini strokes, which we call TIAs or transient ischemic attacks, are more at risk for developing vascular dementia. Also, people who have medical conditions that can wreak havoc on the vascular system, so blood vessels, are more at risk for developing vascular dementia. So think high blood pressure, diabetes, and of course, smoking. But of course, these are also risk factors for other types of dementias as well, which is why maintaining a healthy lifestyle is so important. And then lastly, I'll talk about Lewy body dementia. So Lewy body dementia is most common in people over the age of 50, but we do see it more after the age of 65. In fact, the average age of onset for Lewy body dementia is actually 75 years old, okay? So if I had to sum it up, the symptoms for most neurodegenerative progressive forms of dementia are going to have an onset of 65 years or older, with the exception of frontotemporal dementia, which has a characteristic early onset between the ages of 40 and 65, okay? So I really do hope that that answers your question. If you have any other questions, please feel free to leave a comment down below. And until next time, bye guys.